what's the procedure around the 5 minutes? When the 5 minutes, do you let them know? Is there a clock? What's their, how do they know when time is up?
Yeah, the interlocutor has a clock in front of her or him. The candidate doesn't, but usually when it's coming towards the 5 minutes, by then, just by the nature of the role play, you should have moved to the last point. And if you are not there, then the interlocutor will possibly move you towards that end point, and will say something that indicates we're coming to an end now, which will probably be something like, so you're saying I should do X, Y, Z. They will perhaps, start to wrap up the conversation. So you need to be listening out for those indicators. If it gets to 5 minutes and you're in the middle of a sentence, the interlocutor will just say, thank you, that's the end of the role play. That's not necessarily a bad thing. It's just, but we have a certain time to stick to, that's all. So don't take that as a bad sign that the interlocutor stops you. But of course, it's always best from the candidate's point of view to go through the points on the roll card and cover all of them.
Maureen, what's becoming pretty obvious to me is how much the interlocutor is helping the candidate to do their best, to give their best performance, because there is this kind of consensus in I think it's because of the whole IELTS scenario, the saga, I probably call it as well, previously, where so many medical professionals were having difficulties with getting a 7.5, well, 7 for nurses, 7.5 for doctors. They almost have it in this head that the world is against them, and whether it's OET or IELTS, OET and IELTS do not want you to get the passing scores. And it's becoming blatantly obvious to me in just the last 10 minutes that we've spoken to you that someone who's, and I will actually be curious to know how many role plays that you've done previously, how much you're trying to help the person that you're doing the role play with.
Yeah, absolutely. Our job is to help the candidate and also to help the assessors. Yeah, but I'll just pick up on one thing you said about how we are trying to help them. Candidates, it might be useful for candidates to know that our role card often has words like, I've written some of them down, you are angry, you are anxious, you are nervous, you are frustrated, you don't understand, you aren't convinced, you are questioning the doctor. So the candidates need to be aware that is part of our role play. That's not us. That's what we've been told to do on the role play. And I think almost all the role plays I've seen have involved somebody, a patient, who is either angry, upset, frustrated, doesn't understand. Reluctant comes up quite often on the interlocutor's role play. You are reluctant to follow advice. You are reluctant to believe what the doctor says. So the reason for that, though, is to test the candidate's communicative ability in English, and are they able to respond to what I think are quite real life scenarios for many doctors and nurses who encounter lots of patients like that. So if you get an interlocutor who seems to be being a bit difficult, it's because he or she will have that role on their card. So don't take it personally. Use it as an opportunity to show that you are able to explain clearly, that you're able to reassure somebody, that you're happy to repeat information, that you can check that the person has understood, and so on. So they're all